A very good morning to one and all. This is Dr. Jyotirmay, consultant gynecologist and fertility specialist from Avira Hospital. So today we are going to talk about hyperprolactinemia. So the prolactin is the hormone which is secreted from the anterior pituitary, and its secretion is under the control of the hormones which is secreted by the hypothalamus. So whenever the prolactin levels are more than 35 in the blood, we call it as an hyperprolactinemia. So how this prolactin levels, increased prolactin levels are going to affect the fertility is that, so whenever these increased prolactin levels, they will inhibit the pulsatile secretion from the hypothalamus of the GnRH. That is, the secretion of GnRH from the hypothalamus will be reduced, and this GnRH, whenever the GnRH values are reduced, so the GnRH should act on the pituitary gland, and that will help in the release of FSH and LH, which are essential for the growth of the follicle and release of the follicle. So whenever this prolactin is inhibiting the secretion of GnRH, what happens is that the FSH and LH will also be reduced. So whenever the FSH is reduced, there will be no follicular growth, and whenever the LH is reduced, there will be no release of the follicle, and that leading to no growth of the egg and no release of the follicle, and in turn leading to infertility. Apart from that, the patient will be having irregular menstrual periods, and she might be experiencing secretion of milk from the breast. And apart from that, the patient might be having severe headache and also diplopia, that is a double vision. So what are the causes for this hyperprolactinemia is that, so hyperprolactinemia will be associated with hypothyroidism. So in hypothyroidism, the TSH values increases and also TRH values increases. This TRH, it will be acting on the pituitary for the excess secretion of this prolactin hormone. So whenever we are correcting the prolactinemia, even the hypothyroid also should be corrected. And not only that, whenever there are any micro or macro adenomas of the pituitary gland, the patient will be having this hyperprolactinemia. So we are having medical management and the surgical management. Medical management is that dopamine agonist can be given, and whenever the size of the adenoma is large, then we are going for the surgery, that is transsphenoidal resection of this adenoma. This is how we are going to treat the hyperprolactinemia. Thank you.